Okay, so it's 1 o'clock now. So I'm going to make a start. So welcome to today's webinar, which is bowel incontinence. So over the next sort of 45 minutes or so, we're going to be looking at bowel incontinence and what that means. Just to introduce myself, my name's Lucy Caldwell. I'm the registered nurse at Carebeans, and you will be getting next week probably a link to the email that you registered with. And that will allow you access to the recording of this session and the slides, also a resource pack with some useful information on it, and also your CPD certificate as well. So we'll get going. I'm just going to turn my camera off for this. Okay, so we're looking at bowel incontinence, supporting service users with bowel incontinence. So this might be in the home care environment, or it might be in the care home or residential environment as well. So it's looking at supporting the people that you support with bowel incontinence. And we're going to look at just some support suggestions for when you plan your care for those people. So we'll look at care planning as well, and we'll go on to the system as we normally do. And I can just sort of navigate around the system and show you where the continence care plans are kept, bowel charts, etc. So what we're going to be covering is what bowel incontinence is. So what does it mean when we're talking about bowel incontinence? That's what we're going to be looking at. We're going to look at the symptoms of bowel incontinence. We're going to be looking at when to seek advice, urgent or non-urgent. We're going to look at how bowel incontinence is diagnosed, as well as treatment for bowel incontinence. And we'll look at the causes of bowel incontinence as well. The information today has been sourced from the NHS website on bowel incontinence. So that does offer plenty of information on the NHS website, correlates with what I'm talking about today. And then, of course, we're going to be looking at support and care planning for those people in using your service, and how to care plan appropriately. So as I said before, if you have any questions, feel free to unmute yourself, but it might be better if you put it in the chat. But we'll have a Q&A at the end as well. So if you've got any questions at the end, that's fine. We can run through anything that they might be querying. But I'll also periodically look at the chat function down here just to see if there are any messages that people have put in. So I'll look at that periodically as well. So what is bowel incontinence? So bowel incontinence is when you or someone can't control when you pass a stool. So if someone can't control when they pass a stool, then that's what bowel incontinence is. So, I mean, I've used the term there, pass a stool. You could use the term open bowels. It might be that you use the term go for a poo. So, of course, you need to, just use the language that person understands who you're having that discussion with, i.e. the service user, about their incontinence. So it's just important to use whatever appropriate terminology you feel is best when chatting to that person about what support they want when it comes to bowel incontinence. But if we just look at symptoms of bowel incontinence, I'm just going to get everyone to mute if that's all right. I'm just going to quickly mute all, just so that there's no background noise. Just helps a bit, thanks. So if we look at symptoms of bowel incontinence, if you can't control it, then symptoms might look like the following. So there might be leaking, so feces sort of leaking out, in other words, without you being able to stop it. That's the sort of, the symptom of bowel incontinence is uncontrollable leaking. It might be the feeling that someone needs to go to the toilet and pass a motion or pass a stool, and not getting there in time. So that would constitute bowel incontinence as well. It might be that someone can't get fully clean. So after they've been to the toilet, they can't sort of clean themselves fully. There's still continual leakage. And it might also be indicated by streaks or stains in underwear. So feces in the underwear, that could also suggest that people are leaking a stool. So they're the sort of symptoms there of incontinence. So if someone is experiencing that within your service, there's certain actions that you can take. So advice-wise, so non-urgent advice, in other words, seeing a GP, That might be if you think someone has bowel incontinence. So if you think they've experienced any of those symptoms or they've complained to you that they're having those symptoms, then that's when you could contact the GP if you think someone has bowel incontinence. Someone might experience changes in their stools and they're not improving. So it might be that they're experiencing changes that aren't getting better. So perhaps having a softer stool or diarrhea or constipation or anything that's not normal for that person, not usual for that person, then it's important just to contact the GP just to gain further advice on what should be done about that. And the key thing I've just popped on there is just not to be embarrassed. It's just about reassuring the service user not to be embarrassed about the symptoms that they're facing. The doctor's obviously used to talking to people about these symptoms, so it's nothing to be embarrassed about. Let's just look at urgent advice. So you should see the GP or call 111, in other words, NHS 111, to get further help if someone has got black or dark red stools. So if their stools are black or they look dark red in colour. Also, if there's any diarrhea that's got blood in it, any bloody diarrhea, or any sort of bright redness, but sort of red fresh blood in the stools as well. Bright red suggests fresh bleeding. That could be something that's in the lower colon or the rectum or the anus, of hemorrhoids, etc. But if it is darker red or black, then that could indicate that there's something going on higher up in the colon, so higher up in the sort of small intestine. So that could indicate bleeding in the stomach. So for example, a stomach ulcer. So that's something that does need urgent advice from a GP or 111. And also one step up from that is going to A&E or calling 999 for a sort of immediate urgent advice if there is non-stop bleeding or if there's lots of bloods and clots within the stool. So if that's seen in the toilet or the commode, etc., then you should seek urgent advice and go to A&E, take that person to A&E or support that person going to A&E or call 999 for further advice. So now if we look at how bowel incontinence is diagnosed. So if the GP thinks that you might have bowel incontinence, so if you support someone to go and see the GP, or the GP comes into the home or wherever, they will want to talk about the symptoms. So they'll want to discuss what symptoms that person's been having. So it might be a good idea if you're going to see the GP with a service user, for example, just to list the symptoms that that person has been experiencing so that it's really clear, you're sort of forearmed with your information that you need to take to the GP to talk about the symptoms that you've been experiencing. The GP will potentially do an examination, so that might be feeling abdomen, the tummy. And also it might be that the GP needs to sort of feel inside the person's bottom with their finger, so a gloved finger, just to have an examination just inside the bottom. They may also suggest that you take a sample or the service user obtains a sample, so a sample of feces or a sample of poo. Over here you can see on this image we've got the little sample pot here with a little scoop on the end, so it just requires a small scoop of feces in that pot there, which is screwable, and then that can be handed in for further testing at the lab. The GP or whomever would give you advice on the appropriate way to gather that stool. It's important that it's not sort of fished out of the toilet, i.e. hasn't gone into any water. So there's ways and means that you can do that. You might want to capture that in a commode, or it might be that you can capture that within toilet paper somehow, but it mustn't touch the water. But they would explain all that on how to obtain a sample in the best way. So that's something that they may suggest that you do. They also might do a referral to a specialist. So for further testing, for example, so that could be someone such as a gastroenterologist, i.e. someone that specialises in digestive systems, in the digestive system. So that includes the bowel. There's various tests that the GP may do or refer you for, or refer the service user for. Blood tests, so they might want to take a blood sample. It might be that they get referred for a colonoscopy. So a colonoscopy, there's a little image here. It's a test just to check inside the bowels, and it uses like a thin, flexible tube with a small camera on the end, just to have a look and see what's going on for further investigation. Or an ultrasound scan as well is something that might be suggested. So there's various tests that can be done when bowel incontinence is experienced. So if we now look at treatment, so there's various treatments for bowel incontinence, and it all depends on what's causing the symptoms and how severe they are. But a few treatments we're just going to look at now. So the GP might recommend a dietary review, so just to see what that person is eating and drinking as well. And they may suggest changes to diets, tweaks to diets, increase in certain foods, decrease in certain foods. We'll look at that a bit further on as well. They may recommend medications. So there's certain medications that may make someone go for emotion less often. There might be medicines out there that they suggest to soften the stool, so laxatives, for example. They may suggest incontinence products, so things like pads, we can see over here, pads and pants, and that sort of product to assist. And then also there's plugs, so there's sort of medical devices that can be popped just inside of the bottom, just to control any loose stools or stools that someone can't control. If these things don't help, which they might do, this would be the sort of first line of treatment. But if these things don't help, they might then refer you to a specialist service. So I'll look at those now in the next slide. So treatment from a specialist service, that would be an incontinence service. That's likely to be an incontinence service that person is referred to. They can also review diet, so recommend an increase in certain areas or a decrease in certain areas diet-wise. They would recommend, sort of dietary intake. They might recommend exercises, for example. So it might be that you're referred to a specialist that can help give that person exercises, for example, to strengthen your pelvic floor or to strengthen the muscles around your bottom. And they might give recommended techniques as well. So there's certain techniques that can be given to help empty the bowel. So to have a bit more control about when your bowels get emptied. And if these things don't happen, then there's the potential that someone might be referred for surgery. So that's if other treatments haven't helped or symptoms are, severe, for example. It might be that surgery is an option. So if we look at what that surgery includes, the service user would be given plenty of information about this, but there are surgeries out there to repair muscles, so muscles in your bottom. So the muscles that control when you pass a motion. So that's the anal sphincter is the muscle there. So there might be surgery suggested to repair those muscles. There is the ability to create a new anal sphincter, and so the muscle in your bottom, and that would be done by using muscle that's taken from the thigh, for example. There's also artificial sphincters out there. So an artificial sphincter could be placed inside the person's bottom just to control better when they go for a pass a stool, go for a motion. There's also devices that can be put under the skin. So they are put under the skin just in your bottom, and that uses an electrical pulse to help you control when you pass a motion too. So there's different surgeries that are available. There's a couple more on the next slide as well. There is a small tube that can be placed in the abdomen, so like a catheter that can be put through into the abdomen through a small hole that can be used to flush water through. That can also help to empty the bowels. That could be an option too. Or there is surgery to make a small opening in the abdomen. So if we look at this picture over here, that is a stoma. So it's making a small opening in the abdomen, which is a stoma, where a pouch or a colostomy bag, as we've perhaps heard them referred to, a pouch is put on to collect feces. But the surgeon would explain risks and benefits of the operations, what will happen, and provide lots of information for the service user. So next we're going to look at support that's available if you've got bowel incontinence. So there is help from NHS talking therapies. Obviously, having bowel incontinence or experiencing bowel incontinence, whether that's a short-term thing or a long-term thing, that can, of course, affect how people feel about themselves. It can, affect how people are feeling. It can affect people's mental health. So it can be good to go to these talking therapies just to discuss and talk about how you're feeling, how it's making you feel. Those talking therapies are free on the NHS, and they can just provide information and sort of help that person find ways to cope with the bowel incontinence that they're experiencing. That help can be available in person. It can also be available by video or over the phone, and often there's online courses as well that can be done. So depending on accessibility, will depend on sort of how that is delivered, that information. There's support from charities as well. So there's national charities that can offer support and information about bowel incontinence. There's a bladder and bowel community that can offer information and support for people with both bowel and bladder conditions. There is such an organisation as the Bladder and Bowel UK. So this is the little logo down here that you can see on the bottom right. And we've got a link there as well, which takes you to it. And as I say, you'll get these slides next week when you get your information sent to you. So you'll have access to these slides, which will have this link. So do go onto that website and have a look, because there's lots and lots of useful information that you can pass on to the service user, or you can give the link to the service user to have a look themselves. And they will potentially get a lot of benefits from visiting that website, and just for getting some extra information, really give them an element of sort of, independence and control with that. There is also, you may have heard of this particular service, but there's a radar key that you can get. And a radar key is a key that unlocks lots of accessible public toilets. So they'll be in places like cafes, restaurants, shopping centres, for example. And it's a key, it's like a universal key that enables you to unlock those public toilets. So it's all about offering easy access in public to toilets. So it might help to get one of those, or help the service user to access one of those so that they can easily access a toilet when they're out and about in public. You can usually get those from charities. The Bladder and Bowel Continence website that I've just told you about with that link, that would also talk about that radar key. So that's just something to bear in mind, to pass on to service users as something that would be available to them to make toilets easily accessible in public. And the next slide, I just want to talk about what causes bowel incontinence. Obviously, there's many different reasons why one might experience bowel incontinence. And it can happen for lots of reasons, and it is common. And again, it's something, sort of lots of reassurance is often required when it comes to bowel incontinence. It's, can be an embarrassing point for people. But someone might experience bowel incontinence if they eat certain foods or drinks. So, for example, spicy foods, that might make someone incontinent if it creates a sort of urgency to use the loo, or drinks with caffeine in them as well. Stimulates things and increase that urgency to go to the toilet. As we've said before about those weaker muscles around the bottom, weaker muscles can happen around your bottom as you get older, or it could also be due to things like hormonal changes or childbirth. Women that have had children might experience sort of weaker muscles around the bottom. If someone's got a health condition that affects the digestive system, so it might be that they're constipated, or they've got irritable bowel syndrome, for example, or Crohn's disease. These are all things that might make it more of an urgency to go and open your bowels. and also health conditions that make you less aware of when you need to go to the toilet. So things like dementia or a learning disability, a stroke, for example, or certain conditions where there's damage to the nerves in the spine, like a sort of lessened sensation. And it might be that people don't realise, when they're needing to, open their bowels. So it can be a result of one of these things or more of these things, a few of these things, but there's lots of different reasons. So this is where I've sourced the information from today. Again, you'll get this on the slide when you get this access to these next week. The bowel incontinence section on the NHS website. So that offers lots of really good, useful information about bowel incontinence. And it sort of explores the things that I've been covering today. So what we'll do now, we're going to look at support and care planning for someone with bowel incontinence that's using your service. So the following support points that I'm about to discuss or talk about or suggest, they are suggestions only. And we do have these suggestions in the template text that's within the continence care plan on the system, which I'll show you how to access that. So these suggestions that I'm talking about now are in that preset text that you can pull through to your continence care plan. They're kind of sort of common sense areas of support that you may want to think about when you're supporting someone with bowel incontinence. So the care plan, as always, should be individualised and centred around the person that you're supporting, and it should always focus on their needs and their preferences. And as always with care planning, it's about planning ahead. So in terms of bowel incontinence, we're thinking about planning ahead for that person. We're thinking about promoting continence rather than just accepting that this person is incontinent. It's about looking at ways in which we can promote them remaining continent. So it's about being proactive when we're thinking about our care plans. So rather than a sort of containing of the problem, it's about promoting continence. So especially those like living with dementia, for example, who may not know when they need to use the loo, for example, or not be quite sure where the loo is. It's about thinking about those things, planning ahead, being proactive, and supporting that person to remain continent. And of course, it's also about preserving privacy and dignity. That should be at the core of everything we do when we're care planning. So let's have a look at some of those support suggestions now. And as I say, it's in the preset text, which we'll look at in a sec. So there's just a few sort of key statements here, which I'll say is in that preset text. So as I just said before, it's about prevention. It's about prompting and supporting to use the bathroom so that you can, hopefully help that person to get there in time before they're incontinent. It's also about checking clothes and underwear to make sure that they're not soiled, and to assisting that person, what you need to put in place to assist that person if they have been incontinent. As I said, it's about maintaining privacy and dignity. So that needs to be maintained at all times. And this is what you can put into your care plan. So things like ensuring that doors are closed, curtains are closed when any personal care is being given. It's just making sure that you communicate with that person in a respectful manner, in a discreet manner. It's whether that person prefers a male or female carer. So all these issues that sort of help maintain privacy and dignity should be included in your care plan for that person. So explain interventions is the third point on the slide. So staff should explain any interventions that are taking place, and you should detail this in the care plan so that that person's fully informed about what's happening. So you can perhaps write in your care plan how best to explain those interventions with that person, whether it's using pictures, whether it's speaking clearly, whether it's ensuring people have got their hearing aids in, and all that type of thing. So it's important to explain any interventions that you're doing. Call bells and alerting aids. So in the residential setting, for example, it's about ensuring that the call bell and other alerting aids are within reach of that person and that they know how to use them. So they can easily ask for help if they need it or support going to the toilet. It's about making sure those call bells are working and that they're within easy reach. And this is all information that you can put into your care plan to help support that person. And then, of course, having a clear and signposted environment so that people can have easy access and they know where they're going when they do need to get to the toilet. Before I go on to the next slide, I'm just going to pop down here and see if there's any messages, which there isn't, so we'll carry on. So checking incontinence pads. So if someone is using incontinence pads, it's about checking those and also recording the frequency of that. So it might be that this person perhaps needs their pads checking every 2 to 3 hours, for example. And that should be recorded in the care plan, how often that should be checked, just to make sure that there's been no soiling. And if there has been, that they're not sort of sitting in that for long periods of time. It's good to record any episodes of incontinence, so to keep a diary or do an incontinence assessment on that. You can sort of put bowel charts in place to record any incidences of incontinence. We do have a bowel chart on the system, and I'm going to show you where that is. That's the Bristol stool chart that I'm sure you'll all be familiar with. But that's the best practice tool that's out there that we have on the system. And that's a good way to record what type of stool they've had. But also you've got the notes section in there just to record whether they were continent, whether they were incontinent, so that you've got a record of that, so that you can identify patterns and bowel performance. So personal care and skin integrity. It's really important, as we've just said before, that personal care is given in a timely manner, so making sure that no one's sitting in soiled underwear. It's important to make sure that skin is checked regularly, and that the appropriate creams are applied. That can also be put into your care plan. We'll look at the next slide. So I've put here practice universal precautions. So universal precautions are basically treating all blood and body fluids as if they were known to be infectious. So it's about practicing universal precautions so that no infection can be spread. Encouraging good or excellent hand hygiene for both yourself and the service user. It's about wearing the appropriate PPE, so the appropriate personal protective equipment. So staff should be using PPE when they're supporting, when that's appropriate. So, gloves, for example, aprons if necessary. And also it's about managing laundry and waste and keeping on top of that, ensuring that it's managed and any waste is disposed of safely. And then the final slide on support and care planning. And as I say, these are only suggestions. They're just things to think about. And you can embellish on these further when you're individualising your care plan for that person. But I put here about psychological support because it's important to offer psychological support. So as we said before, it's a real, heavy thing when someone's incontinent of their bowels. It can make people feel quite low. People need to be offered reassurance and just ensure they're kept fully informed about what's going on and how you're going to support them as best you can. It's about making appropriate referrals, so that could be to the GP if someone started to experience incontinence, or appropriate referrals to an incontinence nurse, for example, to get treatment plans, information, advice, that kind of thing. I'm sure, as we're all aware, incontinence nurses can also and GPs can do prescriptions as well for pads, appropriate pads and things as well. And yes, it's about just getting treatment plans in place. If you have seen an incontinence nurse or GP, it's about commencing recommended treatment plans and incorporating that into your support section as well. So we're going to go on to the system now, and I'm just going to show you where the continence care plan sits, and I'll show you the bowel chart as well, and also how we can pull up reports on bowel patterns, etc. So before I do that, I'm just going to check to see if there's any messages, which there's not. Okay, so let's go on to the system and just have a look at what we've got in place. So there may be people on this webinar today that aren't customers of ours. So if you would be interested in a demo on the system, do feel free to let me know. My email is lucy@carebeans.co.uk. Lucy, lucy@carebeans.co.uk. Do feel free to drop me a line and I can always provide a demo for you. And to existing customers, it's just about helping you to navigate, make sure you're fully aware of where everything sits within the system. So first of all, let's go into our service user management page. We'll go into Sally Webb. We'll go onto our care plan page. There you go. She's got one here for continence. So there is a continence care plan available for everybody. If you're in the home care service using the home care environment, you'll have a home care plan in there where there's a section on continence, or you do have a continence care plan available to you if you wanted to make use of that as well. But you will have that preset text too in both the home care and the care home environment. So if I just click into that care plan, this is one that I've already created. So I've been reviewing this on a monthly basis. And then I've got my care plan section here where we're looking at sort of what issues there might be. So she's incontinent of urine and feces. We could perhaps put the reasons why, if we know what the reasons are why that person might be incontinent of feces. We can look at the goals. So we discuss the care plan with the person that we're supporting, and we'd find out what their goals are, what they want to achieve. So I've put here, for example, to help Sally remain as independent as possible, and to have her privacy and dignity maintained at all times, and to have regular bowel movements and to remain continent. So all about continence promotion where possible. And then here I've put some support in place. So it's just what we've been looking at now. It's all on those slides. And I've just popped that in place here. So for those of you that might use the system that are unaware of the preset text, if I just go to somebody that, let's have a quick look. Someone that hasn't had the continence care plan done yet. If we go into this care plan section here, so this is empty at the moment, this is where you'll find your text. So for the needs section, it will pull up a statement there, and you can embellish as to why that might be. You've got goals. And again, you can discuss these goals with the person themselves. And then you've got suggested areas of support, which is just what we've looked at then on the slides. We've popped it there. So the support, if I do this, it will pop that preset text in there. It's not writing your care plan for you. Obviously, they're individual. You need to go through this, check it's all relevant. It's kind of a starter for 10. So, for example, there's red text where you sort of need to like fill in the gaps, as it were. And you just need to go through and just check that it's all appropriate and add anything else and embellish further on these statements that are in place. So that will help you create a sort of best practice promotion of continence care plan. What I've also put in place, let's just go back to Sally. I want to show you what I've also put in place for Sally, which is a bowel chart. So within a continence care plan, I've also created a bowel chart for Sally. Okay, so we can create it within the care plan, or we can create it up here and just link it into that care plan so that we can always see it as part of our reviews and everything. But if I go into this action page here, now you'll probably be aware that we have the ability to just switch on a bowel movement chart, but this doesn't allow you to put any sort of person-centered instructions on. So I would suggest creating an action and then attaching a chart to it, because then you can put person-centered details in it. So what I mean by that is I've created this bowel chart here. If I just go into this, I've put some person-centered details in here, which I can't do if I just switch on an observation. So I've attached a bowel movement chart, the Bristol stool chart, to this action, and it now looks like this. So the support workers or the carers on a day-to-day basis would go into that person and they would go into their bowel chart here. Okay, so they simply click on that. It shows that person-centered text. So for example, I've put here that her continence is being assessed, and I need to record in the notes if Sal was incontinent or continent. And any further details, I can record that down here, and support Sal with hand hygiene. So I can put all that sort of nice person-centered text down there, really individualise that action. We pick the appropriate stool, and then we can record in here whether she's been continent or incontinent, whether there was some leakage or what have you. And then you can just put up reports on the bowel movements, which I'll show you. And you'll also notice down here that we've got the past 2 entries. So we can look at further reports, but just for a quick reference, we can have a look. So I can see here that she last went on the 24th. She went twice on the 24th. And I can see as she was incontinent, she felt an urgency to go, and her stools are getting a bit softer. And I can see here that she was incontinent. She was unable to reach the toilet in time. So I can have a look and see what's been happening. Okay, and if we're concerned about anything, as always, if we're concerned about something, I'd probably want to hand that over. So by clicking that, that will put that piece of information into the handover. So I remind myself to hand over to the next shift. The next shift can also refer to that handover to see what's been happening, and I can refer it to the manager or whomever has got access to this operations dashboard on the left over here to see what's going on, so they can be alerted as well and save that. Okay, that wants me to write a note, so I have put a mandated note in here. So let's put continent feces with extra information there and save. So that's the bowel chart. So as we've just seen, we can see the last 2 entries on here, but if I'm wanting to investigate that a bit further, I'd perhaps want to pull up a report on that. So if we're keeping a track of bowel patterns and performance, so that might be for an incontinence nurse, for example, we can go into the service user management, and we can go into the observation section here. So if I go into the observation section for Sally, there you go, it's got her name in there. We can choose to have a look at the bowel movements. This is defaulted to the last month. I could click on that and put a bigger date range in if I wanted to. So I might want to look from the start of February up to present day and apply that date range. So that has now been applied up there. And then generate a report. And then when I scroll down, I can see all the information that I need to see. Obviously, this is the demo site, so she's not, it looks like she's not been for 2 months, but this is just the demo site, of course, but this would be a sort of full, a full page of information there. So you can see here, we've got the latest time. So that was just now, the latest date and time, what type it was, the description of that type, and the notes that were attached to it. So we can very clearly see patterns of bowel performance there. You can print that off if you needed to. So that will attach your print, of course, or you could save it as a PDF if you needed to send that to an incontinence nurse, for example. So just bear that in mind that you can do that if you need to. I'll also show you actually, while we're on this observations section, you can see it defaulted to Sally because I did it via Sally's file, if you like. But I could choose while I'm on here to look at all of the service users. So that gets rid of Sally from over here. And I want to look at all of the service users, all of the bowel movements within the last month. Generate a report, and that will show me everybody's, which I can print off if I need to, or save as a PDF. So that will just go through everyone's bowel charts so that we can have a look and assess that as well. So we've looked at the care plan, the continence care plan, and how we're going to support for any bowel incontinence, how we're going to promote continence. We've looked at the bowel charts and how we would attach that to a daily action so we can put some nice person-centered information. And then we've looked at a diary, if you like. We've looked at a report of what's been going on in terms of continence or incontinence when it comes to bowel movements. So that's just a nice little loop there of support that we're giving to see how we can make any improvements. Of course, you'd conduct a review monthly or however often you would need to do that. If you need to change, you would conduct a review sooner, and you can change the care plan accordingly if you need to put in further support, for example. So I hope that is helpful to everybody. I'm just going to have a look and see if we've got any questions. But if there are, do feel free to either unmute yourself. It might be better if you put it in a chat though. But it's up to you. I shall just give us all a few minutes just to see if there is anything you wanted to add or ask or suggest. Okay, so it doesn't look like we do have any queries. What I'm going to do is I'm just going to pop my email in here so that if anybody wants to ask me any questions away from this webinar, feel free to do so. If there's anything that people are a bit stuck on, drop me a message. I'll be happy to help you navigate the system or give you any tips or advice. So do get in contact if you want to. As I say, if there's people on the webinar today that aren't customers, do feel free to drop me a line if you wanted a sort of demo of the site. We can go into that in a bit more detail with you. If that's something that you might be interested, more than happy to show you. Okay, so it looks like there's nothing that's going in the chat, no questions. So I'm hoping that's a good sign that you've all understood and followed the webinar today. So just to reiterate that next week you will get a link sent to your email. It'll be the email that you use to register for this webinar, and you'll get access to this recording, including the slides. You'll get access to a resource booklet, which tells you all about bowel incontinence with those support suggestions. And you'll also get access to the CPD certificate that will be available to you to show your attendance for your continuing professional development. Okay, so I'm going to pop my camera back on, stop sharing, just to say hello and goodbye to everyone. But if there's no further questions or anything, then it was lovely to see you all. Next week we've got, sorry, next month so end of, where are we now? End of April, I'm actually doing one on urinary incontinence, so bladder incontinence. So if you want to come and join that, do feel free. If you go onto our website, www.carebeans.co.uk, then you can register for that. And we'll send you details of that link and everything nearer the time. So lovely to see you all. Thanks for joining, and I hope to see you next month. Any queries, do drop me a line. I'll be happy to help. Okay, so I bid you farewell. Goodbye, everyone. Thanks for joining. Bye-bye.